What's the sentiment? What's up with our broken healthcare system? Welcome to Sentiment Sessions, the podcast. Today is a very special episode, and I have three very special guests joining me today. First, we have Dr. Edgar Everett of Proficient Chiropractic. We have Dr. Venita Govan, IO psychologist, and we have Dr. Ursula Thatch of BioLife Balance. Welcome today.
Thank you.
Thanks for having me.
So glad that you were able to join me on this very important subject that we're talking about, specifically around our broken healthcare system and some of the challenges that we face in the African American communities. So just want to jump right into this discussion. Just jump right in and just talk from each of your perspectives around what are you seeing in terms of your understanding based off of your expertise, right? What are you seeing from your day-to-day, challenges within the healthcare system, Doctor?
I think overall, the healthcare system itself as a whole is broken, just in the way that it's structured. And I think that's where a lot of the problems begin. On top of that are the disparities that we see for African Americans within this broken healthcare system. So you got a broken healthcare system that's giving out broken care in a way that's broken to African Americans. And I think that's where you really begin to see those problems just kind of, multiply.
Gotcha.
And, we get the worst of it.
Wow. I see some shaking of the heads. How do you feel about that, Dr. Govan?
Just thinking back about with Dr. King, he talked about this back in the 60s, saying the disparities in healthcare is one of the biggest injustices because it leads to death. And if it was broken back then, and we've come so far, supposedly, medically, why is it still broken? It's not necessarily the system that's broken, it's the behaviors in the system that are broken.
It's a very interesting perspective. Would you agree, Dr. Thatch?
I would agree. And interestingly enough, we're spending even more money, trillions and trillions of dollars. We're pouring it into the healthcare system, yet we're getting very unacceptable outcomes, though we're pouring tons of money into it. That makes no sense. If you said it was broken in the 60s, why is it 2023 and the system with trillions of dollars being poured into it broken?
Exactly. So when we talk about broken, help the audience understand what are some of the specific outcomes or things that you say were broken. Dr. Govan, you want to start with?
So if we're looking at the brokenness of it, we're talking about systemic racism. And so racism has been a problem in this country or worldwide forever. However, we are bringing new practitioners into the healthcare system without necessarily addressing where we need to break down the barriers of how their practices are perceived. What are you doing in your practice? During COVID, there was a physician who died because she was not treated properly for her COVID symptoms. And that tells me that she can't even go to her own facility that she practiced at and be safe. And she was a black woman.
Exactly.
So
a black woman, a doctor who couldn't get the care that she needed.
Family practitioner.
Yeah, exactly. And Dr. Thatch, talk a little bit about what you're saying, because I know that you practice in the traditional healthcare system and then you took on an alternative approach to healthcare. Talk to me a little bit about what led you to that. And I know, we had spoken previously about some of the things that you saw that didn't necessarily agree with. Would you equate that to being the brokenness we're speaking of?
Absolutely. So I had practiced in allopathic medicine my entire life, so over 30 years. And I had a private practice for 25 years. And the thing that brought this to my attention was that over that 25 years, I had taken care of these women. I had an OBGYN practice. What I was starting to see was a very disturbing trend amongst my patients. Every year they would come in, especially after they got to a certain age. They're gaining 5 to 10 pounds a year, and their list of medication as well as their chronic morbidities were growing. In addition to being overweight, they were also depressed and anxious, and they were getting very sick. And I was very surprised, but the thing that concerned me the most was what had I missed in this process, and where had I failed my patients in this process, that we get over to this certain age and we're sick and depressed and on a ton of medication. So that was within my own practice that I started to realize, and made me question myself, and what was I doing or not doing in that system that got this population of people that I felt responsible to this point.
And so that's an interesting point you bring up, because you felt like the failure, although you got the education, you went through the proper training, you were following the protocols, but yet you were seeing that the outcomes weren't necessarily lining up with your expectations, or at least what you've been told.
Exactly. And I had to really come to some peace with this myself, and I realized, I practiced the best medicine I could with the knowledge that I had at the time within the system that I was working. So when I learned something different, something new, something better, I realized that it was not going to work in that system, and that was also what led me to leave. It's like this, and here's the thing, I wasn't a primary care physician, I was their gynecologist, but again, very close to my patients. I knew them very well. I talk about how many babies I delivered for the whole family. But the thing is, I'm reviewing these medicine lists and these problems when they come in for their routine visit. And it's like, why is and this was not just one or two women. It seemed like everybody walking into my door for an annual evaluation, and I'm doing their annual exam, GYN exam, and PAP, but I'm looking at this and it's like, what's wrong with this picture? I mean, it was screaming at me.
Exactly. Thank you. So, Dr. Everett, are you seeing the same on your end from a chiropractic standpoint? Patients that come in having various, issues,
I do.
challenges?
First, that's very commendable, Dr. Thatch, because as far as you practiced and cared about the people that you were taking care of, but within that system weren't getting the outcomes that you wanted. And I think that's one of the biggest issues, and one of the things that has to squarely be addressed is the manner in which care is delivered, even from caring doctors. And when it's delivered in a very honest way, it's still not getting us what it is that we need. And that's what I see a lot in my practice, because obviously as a chiropractor, I don't prescribe medication. And I approach healthcare from a different angle. We're much more solution-based,
Okay.
as opposed to disease-based, right?
Exactly.
So we're practicing healthcare instead of sick care.
Exactly.
And that's what our system is. Our system is designed to address sickness and disease,
Exactly.
right? Not to address health. One of the things we say in chiropractic all the time is that once you have the disease, you may want to be within the traditional medicine model, right? But if you don't ever want to have the disease, then you avoid that model as much as possible.
Exactly.
And I think that's one of the things that really needs to be addressed, is the manner in which we approach health itself.
Exactly.
Right? We are not addressing health in the way I think that we should be, right? Being preventative and solution-based. We are just chasing symptoms. So if someone comes in with something, you give them a pill for that thing. They come in with something else, you give them a pill for that thing. Not even thinking about how the other pill might affect this pill, or how this pill might affect that condition. Right? We're not treating the body holistically. So then what you get is that list of, 5 to 10 medications that's pretty standard for every woman over the age of 50. That's pretty standard for every man over the age of 50. And nobody's asking that important question: why is this happening?
Exactly.
And I believe that a lot of that is because it is just symptom chasing, right?
Exactly.
In the care,
Let's treat it
as
on the
opposed to
surface,
saying, right? As opposed to saying, if you do these things, you could possibly, or there's a great chance that you can prevent these conditions.
Exactly.
Or when you suffer from this condition, maybe addressing it in this way might be a better way to address it than to just give you a pill for the things that you're feeling.
Exactly. Go ahead, Dr.
I'd like to just mention, based on your training and my training, you're trained in preventive medicine. In allopathic medicine, you're trained in disease and pathology. And that's a great difference. And I did not realize that until I had sort of stepped back from my traditional education. They teach us disease and pathology. So very well. I tell people all the time, I got, multiple pathology books that are, 4 inches thick, multiple. So once you identify the disease, you give them surgery, medication, radiation, chemotherapy. We are not taught anything on this half of the equation in terms of prevention. Never. The average physician, the average allopathic physician, myself included, receives probably around 8 to 10 hours of nutrition training. So food is medicine. Why are we not teaching that in traditional medical school?
And that's a great point you bring up. Why aren't we teaching it? What do you think are some of the reasons behind the lack of shift in this paradigm, if you will?
Money.
It's quite simple.
Pharmaceuticals.
It's quite simple.
Exactly.
One
So
word.
it just comes down to the bottom line.
There's
Money.
there's no money to be made in health and wellness. And I say this all the time, if you got people healthy, got them eating better, exercising, doing the right thing, taking the right supplements, they might not need the doctor so much, and they may stay out of the doctor's office. So what's going to happen? Insurance premiums and copays are going to go down. The insurance company's going to lose some money. Well, if you stay out of the doctor's office, there's a good chance you're going to stay out of Walgreens and CVS, or the pharmacy, and therefore Big Pharma is going to lose some money. So there's no money in health and wellness.
Exactly.
And plus, it's just the lobbying behind it, right? It's a well-oiled machine, pumping out all of the things that are kind of counterproductive to that, right? Mm-hmm. Making everything that, from fried foods to, taking medications, actually normalizing it, right? That's what what I'm seeing from my perspective is it's all about controlling the narrative and the perceptions around healthcare. The very people that we have in place to support us from a healthcare perspective, our doctors, are also getting pumped with incentives from pharmaceutical companies to promote those drugs. Are you all seeing that as well? What are your thoughts, Dr.?
Absolutely, whether it's generic or the name brand. There is an idea that I can put you on this medication. This is generic version. It is not as expensive, but it still doesn't prevent you from treating maybe the nutrient that's missing in your system as opposed to trying to treat a symptom.
Exactly. I find it just interesting to see just so much out here when I'm looking at commercials and, hey, you got a migraine, but you can die as a side effect. It makes no sense to me that it's acceptable.
It's so ingrained in our culture.
Yes.
To accept, the side effects of medication, right? We see things like the explosion in dialysis centers, right? So there's dialysis centers on every corner right now, right?
Exactly.
Because and it's really only for one reason, because we know that, decades ago, one of the major reasons for dialysis was being a diabetic, right? And now we know by far and away the number one reason for dialysis is medications.
Exactly.
There's a direct correlation.
So talk a little bit about that. So what is that direct correlation? So the medications are destroying the kidneys and
your filtration system.
Wow.
Yeah. I mean, it's really that simple. Is that, and Dr. Thatch could probably speak to this a lot more than I could, but like when you are filling your body full of toxins for decades and decades and decades, what's the expectation?
Exactly.
The expectation is that the body is going to fail, right? And the system that is designed to get those toxins, those chemicals out of your body is probably going to fail.
Exactly.
And when that fails, you need help. And that's where dialysis comes in.
Exactly.
One of the things that I think that's driving most of the diseases that we're dealing with today, renal disease, liver disease, cardiovascular disease, which is the #1 killer in our country of men and women, Alzheimer's disease, which is called type 3 diabetes, and even cancers. Many of those, all of those, I would say, are driven by insulin resistance, which goes back to lifestyle and diet. Insulin resistance is driving all of these chronic morbidities, and they could very easily, be very well addressed with lifestyle and dietary changes. But the reason why we're seeing so many of these things on the rise is because, in addition to the insurance and the pharmaceutical industry killing us, the food industry is also killing us. And sugar is bad, and it's in everything. And
they got fancy with masking sugar.
Sure they did.
It's amazing how they create a different term to
And our government allowed them to do it. It's called, I have a list of 65 hidden names for sugar. 65.
I didn't think it was that high.
Neither did I, but you get very savvy when you start looking at labels, and they allow them to conceal things in labels to not make it as obvious as to what they exactly are. So who's doing that? That's our good old FDA that's allowing that. 65 hidden names for sugar. So even when you're trying to make that effort to eat better, to change your diet, everything is not exactly what it says it is on the label.
They're 10 steps ahead of you.
That's right, all the time. Yes.
Exactly. Well, this is interesting stuff. So what can we do? What could our communities do to help challenge the status quo? It's one thing to talk about it. I'm very solution oriented, and what do we need to really focus on first? Like, if we had an ideal reform approach, what does that look like?
I'd say one of the first steps is a thought shift, a paradigm shift first, in understanding some of the things that we're talking about, in that the healthcare system is not designed to get you well, and understanding that first, right? And that
do people really trust that? You know what I mean?
Right, and that's what I mean.
They can hear you say this right now,
and that's exactly what I mean.
And then walk away and say, "Oh, I'm going to go back to what I'm doing."
Exactly.
But then what you do is you see it on the opposite end. Even Dr. Govan, from a mental health perspective, right? From a behavioral health perspective, you're seeing the outcomes of poor diet and nutrition play out in behavior.
Yeah, and it takes time to change how we think, because the first thing we're going to do is go back to our doctor to get more medication, as opposed to look at our nutritional values. So the prevention is key, but we haven't been taught that. We're in a culture where we have embraced, or we have just submerged ourselves in what we're expected to do.
Mm-hmm. Yeah.
I think in terms of mindset, it has happened on both sides of the equation, in terms of the provider and also the patient. So the provider is also being sort of brainwashed into this mindset, because they are now not they're not thinking, they're following an algorithm, they're following a protocol. And sadly enough, most physicians are now employees of a larger system. And therefore, if they are stepping out of that algorithm that they're supposed to follow, if you walk in and you have this diagnosis, then you shall have this medication, and you better have that documented on that chart. And now the physicians are actually being sort of chastised when they are not following through those protocols. So, and the patient on the other end is expecting those quick fixes. Nobody's got time on a schedule when you have a 10-minute, 15-minute time slot per patient to talk about nutrition. The best thing you can do is get in there, give the prescription, get it done, and you're on your way. How are you writing a prescription for 2 diabetic medicines, and yet diabetes as a dietary disorder, nutrition and diet never came up in the conversation?
Exactly.
There's something very wrong with that.
And you're absolutely right. I have my graduate degree in healthcare management, and I've worked on the payer and provider side. So I've seen both sides of the fence, and I tell you, you're right, exactly right. It's always it's almost like shuffling cattle, just getting them through, what's the diagnosis? Okay, this is the standard, diagnosis we're going to give them, the medication we're going to give them, but not really taking that time to really understand them on an individual basis. It's just like herding cattle again. And all going back to that bottom line around dollars saved. This is money. We got to make money. Nobody really cares. So I got into healthcare because I did, thinking that I was going to make a difference. But once I got to see how it was running, it shocked me how it all was playing out and how patients aren't really getting cared for. They're just getting what they've been instructed. The doctors are just giving them what they're instructed to do, not necessarily having a relationship. And that's one of the things I could say about your practice, Dr. Everett, is that when I came to visit for my appointment, it really is an individual relationship there that you don't see in most practices. So talk to me a little bit, going back to this whole reform things, how are you doing things different at Proficient to help educate and inform your patients?
I think, we started with some of these disparities in healthcare for African Americans, and I think one of the things that is really lacking is on the patient side of things and how they view the clinic or the institution or the hospital or the office that they are walking into, and how they view that space. And that's something that I feel like is critical to healthcare, is simply how you feel about the space that you're in. And so we've always worked really, really hard to make sure that we're creating a safe space for African Americans in our practice, because we primarily see Black people.
Right.
So that's what our practice is, and that's what it reflects in the staff, in the environment we create, in the manner in which we communicate, all of those things, even the music we play.
I know, I love it all. I love it all. I thoroughly
is
enjoy.
Designed because if you really think about it, to walk into a doctor's office, we've always had to shift from who we are to who we need to be in that environment. But it's our health, right? It's our health, and we have to do the shifting. When I believe the office or the practice should be shifting to you, to a space that you're comfortable in order for you to get well.
Meeting those
and that's one of those things that's
needs.
really lacking in healthcare for African Americans, just because we're underrepresented. It's like 6% of medical doctors, we're less than 2% of chiropractors, and you see that across all of healthcare.
Wow.
So as a Black person, it's really difficult to get into a space that you naturally fit into and that you're naturally comfortable. And I think that's the first step to somebody getting well. Is feeling like this is a place that cares about me, that understands me, and it being a place that they can trust.
Exactly.
And that's a cultural environment that you created.
Yes.
Yes.
That's very important.
Very intentional. Yeah.
But I can tell you, again, from my perspective, spending the majority of my career in the allopathic model, you talk about you got into healthcare and realized, okay, this is not working. I spent my entire life there, and then had this sort of aha moment, towards, my 50s. And it's like, what have I been doing with my entire life? And this is not right, and this is not working. But I think just trying to make people comfortable, people just want to know that you care for them. And even in my other practice, I used to tell people, I said, I felt that my patients knew that I could take care of them, but I could also care for them. But that was very limited because of the system that I was working in. And then I was a gynecologist. I was doing their surgeries. I was delivering their babies. I wasn't managing a lot of the other stuff, but I'm in that system, so I was a part of that problem, I felt. Yes.
Yeah.
Makes sense.
And I think that's important too, is that, like you said, is you can create the environment that I'm sure you created, but it's the system as well. Like how what services are you delivering? And I think that, the transition you've made and kind of where we are in chiropractic, in looking at healthcare from an entirely different angle, is now if you add those two together, right? If you can create a safe environment and you're looking at healthcare from what I believe is the right angle, now you get this, this kind of formula or this new algorithm that creates health.
Exactly.
And that's those are the outcomes that we're looking for, is for people to get healthier, right? To prevent them from taking the medications, or to be able to get them off of those medications.
Exactly.
Because we all understand, and everybody globally understands, that for the most part medications are toxic, right? Yeah. They're very, very hard on your body. Exactly. So how do we create an environment that doesn't need those toxins, right? That
Exactly.
doesn't have to rely or depend on them.
And that's a very good point. I think about with the rise of technology, artificial intelligence, me working in that space right now, just knowing where we're going, even from a food sustainability perspective, meaning that we're running out of real food, right? So they're accepting a lot of GMO products. I mean, what do you all think about how do we get in front? We don't even know first of all, we don't even know what is going to do on the body. Like, food is nutrition, but not all food is created equal. So what are your thoughts around some of the challenges that we're facing from just using technology to grow foods in labs? And do you suspect that we're going to see an uptick in potential, problems that we're already facing today, or something different? Do you know?
Oh, absolutely.
Yeah.
For sure.
I think the environment is becoming increasingly more toxic, not only just the air we're breathing, but the things that we're using, the things that we're putting into our body, the foods that we eat. And they're nutritionally deplete, I think, a lot of them. So if you're eating poorly and you're not trying to do anything to balance that out, where does that get you? In a bad outcome.
Yeah.
Absolutely. I mean, a lot of people think they're eating healthy, but even some of the salads aren't breaking down. One of the things that I see on the spa side and the hydrocolonic therapy side is that these foods aren't even breaking down in their bodies and causing all type of digestive issues. So they're promoting more digestive enzymes and things like that. That's for foods that should be naturally breaking down in our system. So I'm just wondering, what do people need to focus on eating organic versus just going to the local supermarkets and just getting something out of the produce section? I mean, there is always an organic aisle, but just want to get your thoughts on that. What are your thoughts, Dr. Govan?
Well, organic means more money. And a lot of our community may be underserved, underpaid. They're not going to go for organic. They're going to go for the most convenient, most cost economical product that they can use, which is usually not the most healthiest. So I think, when we say what can we do, we can start having conversations with each other. We can't change the world, but we can change the world around us. So when people come into our space, we have to be vocal about this and not just dismiss it or ignore it. Just start talking to each other.
Exactly. And probably using other platforms to discuss it outside of just when they show up in the doctor's office, right?
Yeah.
Just more just having
Yeah, I
those
think a lot of conversations are, we try to do that in our practice a lot, but I think that having these conversations and getting people educated, right, is really important.
Exactly.
And I'm one of the last people when it comes to, education. I'm much more of an action type of person. But I think in this situation, it really is important to understand that there's 65 different names for sugar, right?
Wow.
That's something I didn't know.
amazing.
And that's a piece of
Yeah.
information that's critical, right?
Exactly.
Understanding the difference between GMOs and organic when you go shopping. Understanding that if you go to, your neighborhood grocer versus, a big store like Whole Foods or something like that, what can I do at this store that's going to benefit me the most? So information and knowledge, I think, is going to be really important, because if most people can't afford to pay $3 for one banana,
Exactly.
right? But what can I do with the dollar, and maximize my benefit? I think
Exactly.
is something that is really, really important to understand. So understanding and knowledge, I think, is something that becomes really, really important, especially when we're talking about nutrition.
Awesome. Well, this has been a great conversation. I just want to give each of you some final closing thoughts on the subject. Let's start with you, Dr. Thatch. Anything you want to relate to the audience around?
I think I always talk to people about being empowered, and empowering people, I think, is education. You have to be educated to be empowered and to advocate for yourself. You have to take some time to try to learn some things, to be open to some things. Because I think a lot of people have kind of closed their minds off to things because, we're, just take it as it is. But when that's not working for you, you have to be open to be educated and empowered about some new things in order to advocate for yourself. So when you do go back to your doctor's office, you go, well, I want to talk to you why I'm on this cholesterol medicine and I think it's causing me this problem, and is there another alternative to it? I think you have to educate people. I think that's a huge part of it, is education. If you don't know, you don't know what you don't know.
Exactly.
Right.
Exactly. Very good point. Thank you, Dr. Batch.
And I'm just going to stick with the word empower. Knowledge is something that can empower us. Just take the time for yourself, care enough for yourself to become more knowledgeable about what you're putting in your body, food-wise, medicine-wise, and take action for yourself, advocate for yourself, and empower yourself.
Thank
And
you.
really along those same lines is, once you have the information, I think one of the things we have to really examine is, once I have this information, why am I not applying it? Right? Because we'll do nutrition workshop after nutrition workshop, and we teach all of this stuff, and then and nobody's taking any action or doing any of those things. I think getting a great understanding of yourself and why, once you know and once you understand, why you're not applying what it is that you've learned. I think getting an understanding in that area right there can make a big difference for an individual.
And that's a great point. So getting informed, getting empowered, getting to know yourself, all that combined will help to kind of bridge that gap that we're seeing in the broken healthcare system. I want to make sure that the audience, if they want to get in touch with you, can. Could you mind saying your email addresses just so they have that information?
My email address is biolifebalance@hotmail.com.
Mine is Venita, Venita .govan @gmail.com.
ProficientCairo@gmail.com.
Well, I want to thank each of you for joining today. This has been a very great conversation, one that is pretty much overdue. We need to continue to spread the messages around this issue that we're having to the broken healthcare system, specifically how it impacts the African American community. And I want to thank you all for joining Sentiment Sessions. Until next time, have a good one.